community, good afternoon. I am coming in because one, it's been a while, but I'm also coming in to talk about a series that I'm going to do in the next coming week. So, I did a series probably at the beginning of the summer about the process of getting started and some things to look out for, some things to consider, what to do, what not to do. So, I'll be continuing in that same theme and doing another 6-part series on different topics from our group, from our Tuesday talks in our Facebook group. And with that being said, I'm going to go ahead and give you guys the topics we're going to cover. And we'll also do a topic talk today, which is around COVID policy. So that was one of the questions in the group around what COVID policies should you have in place? What does that need to look like? So I gave a little bit of Shamika's take on that. So let's get started into the topics. As always, welcome to our community here on YouTube. If you're interested, which I think you probably are, since you're here, go ahead and click like and subscribe so you can get updated for the rest of the part of the series that we're doing this August and get some more information about what's going on. So I'm going to chat a little bit about what's been happening, and then I'm going to go ahead and get into our topic for the day. So what's been going on? You guys already know what's been going on. NOSACon is officially 7 days away, and we are so very excited to not only be hosting it, but that it's something we talked about last year this time. So last September during TravCon, we hosted a meet and greet with myself and the healthcare partners, and the meet and greet had maybe 35 people there. And it was really nice. We did it at Top Golf and we had a great turnout. And it's always really cool to meet people where you can put names to faces. So from there, I made the decision, even though it's something that people have asked me about for years, to actually host a conference that was tailored to us. So for those of you guys who may not know, TravCon is a conference that happens every year, and it's specifically tailored to traveling healthcare professionals. So they have a 3 or 4 day time period where agencies and companies that support agencies and healthcare traveling professionals come out and do presentations. They have an exhibit, and they get a little bit over 1,500 attendees year over year. So that was their first time kind of having the conference back in place since the pandemic. So myself, who is also a traveling nurse, decided to go, and we participated in the nurse entrepreneur marketplace. And then a couple of the NOSAs in our community actually had booths there, and some of the companies that support our community had booths there. So it really was a good time all the way around. And then I also had a chance to check out breakout sessions. So some of the topics for breakout sessions, and remember, this is kind of healthcare traveling professional centered. Some of the breakout sessions were around bill rates, newbie boot camp that kind of touches on the hundreds and thousands of new traveling healthcare professionals that kind of came in because of the pandemic. And they talked about how to travel in your RV, how to travel with kids, insurance. They talked about a plethora of topics that were really important to that community. So from that experience, and I have been there as a traveler myself, so I think this was probably the third time that I had attended. And then of course there's lots of parties and lots of giveaways and lots of prizes and lots of good energy. I think based on what I was told, they did hit the 1,500 member or attendee mark. They had it in Paris all the time that I've known about it. So it's been something that's happened in that same location. So I think it's a place to kind of connect also for traveling healthcare professionals with friends. So as I say on our platform time and time again, the healthcare traveling space is smaller than you realize. So a lot of times people use that as an opportunity to reunite with fellow coworkers that they don't work with anymore, or in locations that they don't work anymore. So it's always a good time. As some of the NOSAs put it, you have to put on your walking shoes. You'll be walking and just having a good time and going to parties and happy hours for the whole duration of that time. So that's coming again in this coming September, and we'll be there as well. So if you want more information, definitely comment below and say, hey, tell me more about TravCon. And I'll kind of tell you, especially telling you if it's a good fit, if you're an agency owner interested in actually exhibiting during TravCon. So with that, I decided at our event at Topgolf to announce that we had decided as a group, as a collective, to actually host our own conference. And that's what's happening in the next 7 days in Atlanta, Georgia, at the Georgia Tech Hotel and Conference Center. We're excited. And one of the nice things about it is that it really allows us to connect as a community in person, as well as get some of the information, tools, resources that we need to kind of either re-energize or restart our businesses or kind of take our businesses to the next level. So some of the topics that are important to our community that we'll be touching on include joint commission, backgrounds, insurance. Insurance is a big topic since COVID-19 hit in 2020. We're talking about recruiting with results. We're talking about social media, vendor management systems. We'll also have a representative from a staffing software platform to talk about that. So, and then we have a couple of other topics as well, but it's kind of helping us fill in the gaps. Because one of the things that I realized post pandemic is that our industry got a bit of a push in the last 2 years. One of my experiences as being a second career nurse in healthcare is that healthcare is a little bit resistant to change. But I feel like the pandemic pushed healthcare like 10 years forward in 2 years. The amount of technology, the social media presence, the number of companies amidst the industry, entering the industry, kind of how we work, what we do, what makes sense, even the staffing regulations and the social media and technology changes that we've seen really happened in such a short period of time. So we'll be doing that next week. We'll be gearing up. We'll be sharing some clips and stuff with you guys via our social media, and then we'll share some stuff here on YouTube as well. But let's get on to our intended topic today, which is about COVID-19 policies and procedures. As I mentioned earlier, we'll be having a 6-part series. So we'll also be discussing, and it's in the comments below, we'll talk a little bit about travel pay package. We'll also touch on mindset, because around fall, as we enter into fall, is always a great time to restart yourself or do a reset for your business. We'll also be touching on 1099 versus W-2, which is a question that's been around for like the entire 5 years the group has been open. It's a constant question. We'll also touch on social media, how to use social media to manage your business in the way of how to create a social media presence and manage your business. So some systems and companies that we use that might be beneficial to help you do it more seamlessly. And then we'll also touch a little bit on organizational structure. So those are the 6 topics that'll cover our 6-part series. And today we're going to go ahead and get started and jump into it, where we talk a little bit about COVID-19 policies and procedures. So one of the members posted a question and wanted me to talk about it. I didn't get full clarity as to the direction she wanted to go in. So I'm going to go in the direction that I thought the intention was, which is around what policies and procedures should we have in place and what does that look like? So COVID-19 brought us a new way of working in so many elements of our business. And it's important as NOSAs and business owners that we create that new way of working, not only verbally communicating it to our employees, but also putting it in writing. So one of the ways that you can do that is kind of creating a procedure or a policy in your employee handbook. So creating a policy would look like putting something in place that kind of explains your company's process for handling COVID-19, whether it be that the employee has it or they've been exposed to it. You want to have clear protocols as to the steps that they should take, as well as the steps that you would take as a business owner. And it can look something like this. One, you want to talk about what COVID-19 is, ways to prevent it, things of that nature. You want to use good resources like the CDC, the WHO, your state health department to develop the policy, because you want to make sure that you're following guidelines specific to your state. You also want to take into consideration any changes that have happened in your state. And the example would be early on during COVID-19, many states implemented a policy where you had to pay a person a period of time while they were off quarantining or recovering from COVID-19. And that was state by state. So it wasn't something that was federally mandated. And it was also more than likely put in place to protect people from losing their jobs. So, with that being said, I'm not sure, but you should, what states are still implementing that. As of my last check with the CDC, there are implementations as far as quarantining. So, that will be something that I would include in the policy. And also make sure that your policies are in alignment with whatever your client is saying. And what that looks like is you want to kind of have something that kind of encompasses all of your clients' requirements without having to do it client per client. So, for instance, and for this, I'm going to use drug screening as an example. If I have a client that says, hey, I want my employees to do a 10-panel drug screen, and then I have another client that says, oh, I only want my employees or your employees to do a 7-panel screening, as an organization, we would make the policy that we would just do the 10-panel screening for all of our employees. So that's kind of encompassing the highest level of the requirements. So if in your state they say you have to quarantine for 5 days, if your client says they want you to quarantine for 5 days, just incorporate in your policy a 5-day quarantine process. After that, you want to start to begin the process of connecting the dots to make sure that you're clear as far as exposure, you're clear as far as like the status of your employees. So like when they tested positive, you know, you want to make sure that you're keeping in touch with them so that if something else more goes on, you're aware of it. You may or may not be responsible or have to submit a workers' comp claim. So that's something that you want to incorporate in the process. And typically your workers' comp administrators will handle any sort of next steps and processes, but you want to make sure that you're in the loop and you've communicated with them what's happening. And that kind of touches on, hey, this is what you need to do as an employee. This is what I need to do as an organization, or what we're going to do as an organization, and then kind of encompass that into what your policy is so that your employees are clear. Contracts and things of that nature, that's more client based than it is policy based, but you do want to include some sort of contracted information around if you're going to do hazard pay, what happens if the employee tests positive, that type of language, so that whatever they say that they want you to do, you're also doing it, and then vice versa. Exposure, which is a big one. You know, if an employee has been exposed, you know, what is the steps that the facility is going to take, and then you want to take something comparable. So some other things to think about when you're putting together like COVID policies and things of that nature is what types of training and what types of information you're sharing with your employees. So now, especially now that we're going into winter, which of course is flu season, it's always a great idea to do some sort of training around hand washing. You also want to do some sort of training around different types of precautions like airborne, droplet, contact. Those are all areas that are really good to do retraining in as we go into the fall, and of course, as we enter into flu season. Doing those things allows your employees to get the information, and it doesn't have to be where you're doing a live like we're doing here. It could be a pamphlet that you send out that they confirm receipt of and reading. It could be a Facebook Live or a YouTube Live that you do, or Zoom session that you do with your employees quarterly. But doing it a little bit more, especially since we've seen so many things happen with COVID-19, is really important. And I think doing it and communicating what you're doing to your client kind of makes you an ideal agency. Some other things that I would consider around like that policies and procedures when we're talking about COVID-19 is the hazard pay. So COVID-19 and many other diseases like neurovirus or monkeypox and things of that nature, um, you want to have something in your contract that talks about hazard pay. So you don't want to be so specific as to say COVID pay, meaning that they're working with COVID patients, as much as are they being placed in hazardous conditions based on this is, this is what I explained as hazardous conditions, and this will be the payment or additional payment for those roles. So we have outbreaks, and we've always had outbreaks in our industry from other viruses and stuff. So you want to include it as kind of like a catch-all so that it can include you know monkeypox, it can include COVID, it can include neurovirus. And when I talk about include, I mean not so much working with patients as much as outbreaks. So if you're in a setting where there's an outbreak, or if you're on a COVID floor, those types of situations. I think as we get through COVID, or we're post COVID, COVID will be like the flu, like the norovirus, like other diseases that our country manages. So really think through what you're saying and what you're meaning when you're asking for special pay because of hazardous conditions. So that's something that you really want to think about and kind of talk with the client about, as far as any sort of additional pay on top of whatever your normal bill rate is. So, as I mentioned, that's just a little bit of my take on some of the questions. We'll be doing a 6-part series over the next couple of weeks, sharing some of the topics that I've already shared with you guys, and then talking a little bit about it. If you have any topics that you want me to specifically talk about, feel free to drop it in the comments and I'll add it to our next series. But these are all our Tuesday, Thursday talks that we do in the Facebook group that I've decided to share on this YouTube platform as well. As I mentioned, sometimes we're stepping in this direction and then we have to step left. And I think COVID policies and procedures is a great question, because it is something that's important to incorporate into your business, not only as a business owner but for your employees. COVID hasn't fully gone away, and there are definitely parts of the United States that have had consistent outbreaks. So you want to make sure that you're prepared, your employees are prepared, through a policy of what to do, what not to do, what we'll do, what the facility will do, kind of next steps. And then you also want to make sure that, even more now so than ever, that you're reiterating the education around things like hand washing, bloodborne pathogens, different types of precautions, so that even though in healthcare, these are things we know like the back of our hand, it doesn't hurt to send out a infographic or a video or a little snippet of those topics to make sure that your employee is fully aware of what the process should be. So, as always, thanks for being a part of our YouTube community, and we'll see you next week, or probably this weekend. We'll upload another video on the next topic. Thanks again.